This is Dr. Mir Umar Farooq Ali, Consultant General Medicine at Revive Hospitals, Attapur. Of all the viral fevers and cases that we get to see in the OPD, dengue fever is the most common fever that we encounter. This fever is typically caused by a mosquito. It's a mosquito-borne illness caused by the female Aedes aegypti mosquito and is basically of 4 serotypes. Infection by one serotype usually infers immunity against that particular serotype, but not against the remaining 3. This disease has symptoms or clinical features similar to malaria, Zika virus and the influenza virus. Symptoms include fever, which is usually high-grade fever, headache, vomitings, joint pains. And there's a severe form called as dengue hemorrhagic fever. This fever is characterized by low platelet count with low plasma, with bleeding tendencies and high chances of extremely fast deterioration in clinical condition as such. Now, usually in mild to moderate cases of dengue, IV fluids or just fluids, adequate hydration, analgesics and bed rest is more than enough. But in severe cases where the platelet count is low, or if the patient is having severe bleeding, then these patients need to be admitted in the hospital and we have to transfuse them with blood products like plasma or with SDPs or RDPs depending upon the patient's platelet count, and a regular monitoring of the platelet count is also necessary. In severe cases, the risk of death is usually around 0.8 to 2.5%, but without treatment. With treatment, the risk of death significantly reduces to around 1%. And also, the risk of death is high in patients who are usually below 5 years of age or in the elderly people as such, or in cases where the BP is very low. In most of the cases, usually if the disease is detected early and if the patient is hospitalized in time, the mortality significantly reduces as such.